Hello, my name is Jenny Leyva. I'm an entry-level master's student at Pacific Lutheran University, and today I'm going to share with you my quality improvement project that I've been working on for the past couple of months. For my final clinical rotation, I was assigned to be at Valley Medical Center in Renton, Washington, in the clinic network setting. The clinic network setting is primarily outpatient. It consists of urgent care, primary care, specialty care clinics, and occupational care clinics. I worked very closely with the Director of Ambulatory Quality and Safety, Jean Borth, and pretty soon after starting at Valley Medical Center, we jumped right into this project that Jean was very eager to begin. This quality improvement project focused on building a universal protocol timeout observation program for patient safety champions at Valley Medical Center. And that is what I'm going to explain a little further for you. So this quality improvement project revolved around universal protocol, which is created by Joint Commission. The universal protocol applies to hospitals, ambulatory care, and office-based surgical facilities. The universal protocol is considered the universal protocol for preventing wrong site, wrong person, and wrong procedure surgeries. It is a protocol that has been shown to improve teamwork and decrease the overall risk of wrong site surgery. However, given this protocol, even when it's in place, approximately 40 to 60 wrong site procedures occur each week still in the United States. And the clinic network at Valley Medical Center noticed their own gaps in universal protocol and wanted to really create a safer environment and ensure universal protocol was practiced consistently and accurately each time in the clinic network. When you think about performing a timeout, which is a key step within universal protocol, you might not think of primary care, urgent care first thing. And that's what they believe that the staff at Valley was also thinking, because it was not uncommon for timeouts to be rushed, done incorrectly, or even not done at all in the clinic network. And this quality improvement project really aims to take a look at that and implement auditors and observers into the clinic network to ensure that universal protocol is being followed, because it can have a true impact on patient safety and help create a more safe environment. So what we did is we built a timeout observation training for patient safety champions. Patient safety champions were chosen to be the front leaders of this project. They consist of physicians, medical assistants, and registered nurses who are a part of the clinic network, but who also attend the safety committee. So it's a great group of people who are excited about creating safer environments. And to measure effectiveness before and after, we measured perceived competence of the patient safety champions. That leads me to my PCOT question, which was, in patient safety champions, what is the effect of a timeout observation training on perceived competence in observing and auditing timeouts in the outpatient clinic setting? So I worked very closely with Jean over the last couple months and built an educational training, which we presented on May 27th, 2020, to the patient safety champions. 60 of patient safety champions attended the training. The main objectives were to introduce the role of the patient safety champion as a timeout observer. We talked about patient safety history. We reviewed universal protocol, identified the correct process of universal protocol, especially the pre-procedure timeout. We identified common errors that are commonly seen in universal protocol, and we taught them how to utilize a universal protocol observation form in order to audit the timeouts. And the universal protocol observation form was built off Joint Commission standards. Our goal was to have at least 80% of patient safety champions reporting that they felt at least confident or higher in observing auditing timeouts after the training. And we had them complete a 5-point Likert scale. 1 was very unconfident, while 5 was very confident before and after the training. So we submitted this survey, we held the training, we sent out the survey right after, and then the results were analyzed about a week later. Overall, there was a general increase in perceived confidence amongst the patient safety champions. 29 completed the pre-test, while only 16 completed the post-test, but there was an increase in perceived confidence with their familiarity with universal protocol. There was an increase in confidence in their ability to list all of the steps of a timeout, an increase in confidence in identifying a correct versus incorrect timeout, and the oddball of the results was the readiness to observe a timeout in their own clinic. There was actually a 0.01 decrease in the average confidence. However, there was a 0.09 increase in those who reported feeling confident or higher, which to us really suggests that that one was kind of a wash. It really didn't change at all. And if we think back to our goal was met due to 100% of patient safety champions reported feeling confident or higher with how familiar they were with universal protocol. 93.8% of the champions were more confident in listing steps of a timeout. This was the same 93.8% with those who could identify correct versus incorrect timeout. And even though this was the one that did not change, there were still 87.6% of patient safety champions still felt at least confident or higher observing a timeout in their own clinic. So all of those were above 80%, which means that we met our goal there. Some notes that we analyzed after, it's noteworthy that 40% of patient safety champions completed the pre-test, while only 27% completed the post-test. This could have altered our data quite a bit, and could explain the few oddball results. Overall, there was a increase in perceived confidence after the training. The greatest area of improvement was in familiarity of universal protocol, which we mentioned is 100% or higher for them feeling confident within universal protocol. So that was very noteworthy for us. And the oddball of the result was the readiness to observe a timeout in their own clinic, which really just is a great step in the next direction to continue training and to get the patient safety champions feeling more competent, which is what led to our follow-up and for future direction. After this presentation, the following week, we completed training videos where we filmed correct and incorrect timeouts. So that way in the future, patient safety champions can utilize a training video that will be implemented into PowerPoint, and they can use the observation form and live audit some of the training videos. This will help patient safety champions build upon their competence, as well as we can take a look at inter-rater reliability and ensure that all of the patient safety champions who will be auditing timeouts are consistent across the spectrum. And the timeout observations will begin in October 2020. Overall, I think that this project was a great learning tool. I think it's going to absolutely help improve patient safety. And has made me more aware of my own timeouts that I perform at the bedside. I just want to thank my clinical instructor, Dr. Schwink, my course instructor, Dr. Wallace, preceptor, Jean Borth, and the whole clinic network staff at Valley Medical Center. This has been such a fun project and an honor to be a part of. Thank you for listening to my quality improvement project. I hope you learned something. Have a great day.